and suddenly drastically change their diet, that can affect the way their metabolism works and their energy levels, and we can get all sorts of things that fall outside the sphere of your pre-qualification. Advanced airways. I'm not going to take intubation kit on the side of a hill. You need all sorts of other equipment to complement that and guarantee your placement. You could take a King airway, but then again, are we going to take all the sizes? Are we going to take all sizes of LMAs?
And then the BVM that goes with the King, etc., is, you've got an MPA, to me, is adequate.
It's adequate.
And that the golden airway is what's right for the patient. It's not, before it used to be, the platinum was intubation. Well, the UK doesn't intubate anymore, pre-hospitally, pretty much.
A lot of paramedics are going to the eye gels.
Yeah. It's why? Is his airway open? Yes. Can we keep it open with an MPA? Yes.
That's gold standard.
I know it comes into, but what about CPR, which is CPR in the wilderness is a whole different topic.
Yeah, we'll talk about that later.
But it's the management of patients. The idea is to get them off the hill or get them out of the jungle to where, you can have a full intubation kit at your base camp with a ventilator and oxygen, etc., etc.
Speed, distance, time again. How far do we need to travel? What assets have we got? Do we need to stay and play and wait for additional resources, or do we need to move quickly to get away from the danger?
And if you think that the amount of space that an advanced airway kit takes up is probably 3 days worth of food, which you're going to have to sacrifice, or somebody else will carry, or you will have to carry in addition. So you're probably going to become a casualty first. So it's like, do you need it? Yes or no?
It's horses for courses, isn't it? It really depends on where you're going, what the risk is, what your experience is. Some of the key concepts that I would follow, irrespective of the design and the contents, would be try and cut it in half and cut it in half again. Only take what you know how to use. It's very easy to look at the glossy catalogues and see some new Gucci equipment and buy it and take it on your trip. But if you've never used it, not even in a mannequin, then it's probably not going to work under pressure. You need to fall back to what you know and what you're experienced in using. Carry the right paperwork for everything and label everything so there's no second guessing yourself when you're under pressure, or it's dark, or somebody else is sifting through the kit for you, or you get to customs. Label everything. If you can, keep it in the original containers.
Yeah. Also, for me, I like Ziploc bags. If you put it in a Ziploc bag, labelled airway, everybody knows. Bleed, minor bleed, pain. But then also, if you're in a large group, because people will dip in and out of it, if you can use tape with your signature to seal it, every morning when you check your kit, you can see if it's been opened. It might have been opened while you were asleep and somebody's actually really ill and you don't know, but it gives you that almost mini audit level of, why is this open? Has somebody got a problem that they've not told me about? Has it just opened and ripped and I've lost it? It just allows you to account for your minimal kit.
Well, that's a great concept as well. Go from your daily inventory check to your mini audit, as you say. By having a centralised inventory, that's going to expedite your transit through any borders or customs. Otherwise, you're going to have to sit and write one out or type one out for them, as we experienced travelling from Guatemala to Mexico. We had to detail everything from every single tablet and the dose to the serial number on the monitors. If you've got that pre-packed, pre-typed out, multiple copies signed and stamped by a medical director, we'll talk about documentation in a future podcast, but it'll save you a lot of time, looks more efficient, looks more official. It allows officials to cross-reference your list with the contents, and it probably save you from missing your flight as well.
Yeah, and missing the whole expedition that you're trying to get to anyway.
Yeah. And then you're talking about expeditions and flights. Make sure your kit is robust. It might not need to be particularly robust once it's on your back, but when it's getting thrown in and out of aircraft on the way to your start point, customs officials, airport officials, they don't care. They're going to throw things in and out. They're going to stand on things, throw suitcases on top of things. You might find when you open your rucksack, all of your med kit's smashed, so you need to ensure it's well packed, robust and protected.
Which, going back to your top 5 that you can't go without, apart from a 14 gauge needle, you can take all of that in your carry-on.
Yeah.
So it's not going to get lost, because we've all had bags lost. So your bag's now missing, or it's in another country's airport with all the med kit in. Yeah, you've got a day sack, you've got the things that you can't improvise, like your tourniquet, they're in your bag, on your back, with your credit card, and with the right training and the confidence, everything else you can improvise, but those essential items you have. You probably get away with an ampule of epinephrine. Auto-injectors, probably not. I know for Guatemala, they'll just take them off you because they don't know what they are. And the cost of auto-injectors now is maybe not feasible. Yeah, an ampule of an epinephrine, your cap tourniquet, your MPA, they can go in your day sack and you've still got it with you. So your main bag with all your Gucci super kit in is now in Houston, Texas, and you're in Paraguay, but you've still got enough to support you. Yeah, you'll have to go and buy clothing, another rucksack, etc. But your essential kit that you're comfortable with, you know it works, it's not a Chinese import copy that'll snap, you've got it with you.
So I'm going to cut that top 5 down in half and half again. I'm going to go for duct tape, credit card and toothbrush.
Yeah, I go duct tape, ciprofloxacin and credit card.
And you're good.
Yeah.
You can improvise everything else. Fantastic. Anything else to add?
It varies, as we know. It's what you carry, what I carry on the helicopter, what I carry on the ambulance, what we do on wilderness. It varies. We have kind of a basis that we never move. I'm big into using the team. It can be cheap. Give everybody a small Ziploc bag with an elastic bandage, some gauze, some plasters, because then when it really goes wrong, instead of you carrying everything, you've now got, for example, a team of 10, you've now got about 15 miles of elastic bandage, 500 gauzes. Everybody's got the kit. So if you use yours, you've still got a bit. So I like disseminating. Yeah, I still carry mine, but everybody carries their own.
Well, that's an interesting concept, and I like the idea of everybody having their own individual first aid kit or IFAC, which might be like a trauma-based one, as you mentioned, or it might be their own small one with eye drops, personal pain medications, etc. Then you come on to the concept. If you want to take lots of medical kit, do you keep it centralised on your back, or do you share the kit out amongst the group, therefore distributing the weight?
I think personally, I know there's some textbooks like if you carry a tent, one person should carry the fly sheet, the other people carry the tent. So if whatever happens and you lose the rucksack, you've got half a tent instead of no tent. The problem if you carry everything is if you lose it, you fall, the bag goes missing, you've lost everything. Whereas as long as you have a system and you brief and practice that system, I'm a big believer in splitting it up. However, the kit that we've just mentioned, a tourniquet, if you've got the budget, you could give everybody that kit. So you've now got 5 of those, 10 of those.
Yeah.
If you're going down the IFAC kind of route, the NPAs, you could size them then accordingly to that person. Like in the military, it's your IFAC, we use it on you.
And then you would have a standard SOP or a standard operation procedure within your group so that everybody carries their red first aid kit labelled with their name and blood group in the top lid of their rucksack so that anybody going to that person's aid knows exactly where to go for their medical kit, so they don't use their own, they use the victims, and it's got the victim's personal medications in, their blood group, their personal medical history. You're not pulling out loads of medical equipment or loads of personal camping gear on top of the hill searching in the dark for their med kit. You know exactly where to go for it, and it's standardised across the group.
And what we used to do, security and maritime, is when we got the team together, we did a previous medical history, a scar chart, which is like a figure of a man, and you've got previous breaks, have you got tattoos, and then that was all left centrally. We knew that as the team medic, the important things like allergies, etc. But the more detailed was kept sealed in an envelope in the company office at our emergency contacts. If there's any problems, they can do all the running around and notifying hospitals and next of kin. They've got all the information that allowed you to just be the medic on the ground.
That's a great point. It's very similar with the last expedition we did. The medic knew the medical history of all the patients and all of the clients. Had personal contact, had discussed all of their pre-existing conditions and concerns, but all of the medical history documentation was sealed and held by the team leader. So as you say, he can, if necessary, you've got a second person who can follow things up, who can direct things, can contact the next of kin, run around doing the admin while the medic focuses on the treatment.
And plus that pre-planning of, do you have any allergy? Do you have contact lenses? Maybe a small, what kind of solution do you use? Because if people lose a contact lens, they can't operate efficiently. And they will come to you as the medic for their problem. And do you have a contact solution? Well, I've got possibly normal saline, but I don't have that kind of solution. Or I've got a cheap pair of Dollar City glasses. Sorry, they're not fantastic, but
it's a backup.
And especially if it's a paying client, you've now made them happy. They can see again, like we talked about previously, dentistry, a little Life System dentist kit. That's just one manufacturer I've seen. It's that pre-planning so you can prepare adequately. We can't prepare for every eventuality, but you can cover the main risk. Maybe a bit of extra specific to each client. I know they take X amount of drugs. Okay, you take yours, give me your spare. You have somebody with an allergy, they've got auto-injector. Well, you carry that, I've got your spare. So it's that pre-planning and preventing things happening. You can't prevent everything, but your plan, if you expect it to happen and it does, it's not a problem.
It's not a surprise.
And you're then, as the team medic, not looking flustered, not running around screaming. Everybody else can do that. I've thought of this, I've got the kit, I've got the training, I can just crack on and deal with it safe, efficiently. And everybody knows what I'm doing because I've left a plan with whoever, etc., etc.
Yeah.
This is my emergency contact numbers. It's all on a laminated crib sheet.
You've got your whole medical emergency response plan laid out, which you should have thrashed out in a tabletop exercise with the team leader prior to deploying. So you've tested the telephone numbers, you've tested the systems, you know the routes, you know the alternate routes, you know the capabilities of the hospitals. We had a medical response plan in Kurdistan. We had a guy on an oil rig who lost a finger through an industrial accident. And I transported him to the hospital, the primary hospital, which we'd used several times before and was the primary go-to on our medical plan, only to find it was closed. It was Ramadan. Incredible. There was a religious festival or holiday, Ramadan, and the hospital was closed. So we went to our plan B. We knew how to get there. We had the route. We had the Google Maps stored in our phone. We knew exactly how to get there. Got there, and it was closed. We went to the third option, which wasn't a major trauma hospital, and there was a couple of doctors in there asleep in chairs. We had to wake them up. They had very little experience of managing trauma, amputations like that. But yeah, you need to update your medical emergency response plan and look at the impacts. You might have a fantastic holiday hospital. You might have a fantastic hospital with all of the latest medical equipment and modern diagnostics. But if their CT scanner is out of service, why are we going to that hospital for potential fractures and head injuries? You know, maybe you need to divert to your secondary option or your tertiary option. So every phase of the deployment, you need to ring up and check these facilities, make sure they've still got the same facilities and the same capability, make sure local hotels...
And right here, will A, they accept you, and B, will they accept your insurance company, your travel insurance company, or you're going to get a massive bill that you're not allowed to leave the hospital, so the bill continues every day. So
check the system. Do you need to prepay in advance with cash and then reclaim it through your insurance? Or will the hospital communicate directly